Okay, so we've arrived and we are going to walk inside and get our pre-surgical testing done. Let's see what it involves. So check-in was really easy. Just give your name, they go over your medications list, and they make sure that your insurance is up to date. And then we wait for our turn.
Okay, so are you fasting today?
Yes.
Oh, are you?
I did. I didn't eat anything today.
You're so brave in the afternoon. That's great.
I don't get up till 2.
Because I had there's some labs that they wanted, right?
Yes.
Okay. And those are the ones that were already ordered?
Yes.
Okay. Any other areas of concern to talk about today?
No.
Besides the pre-op?
Just the pre-op and then the mobility form so that they can tell where I'm at.
Okay. Any allergies to medications? Any new ones?
No.
Okay.
All the same?
Meyer Homer Glen is your pharmacy?
Correct.
Okay. And then did you peruse this medication list?
No. I didn't even look at it.
Great.
But I did do it online already yesterday.
Okay.
So there should be nothing on there that isn't. It's just the Belboca, the Norco, Fleck. It starts with a V, 37.5 milligrams.
Yep.
The gabapentin.
Yep.
And then the Movantik, I think it's called. It's not, they don't have it listed as Movantics, they have it listed as something else, but it's in parentheses, Movantics.
Yes.
And then the Benz or something, it's the small milligrams, I think it's 5 milligrams. And then the vitamins.
How about the iron?
Yeah, just the vitamins after that.
Okay, B12.
Yep.
Multivitamin. And then the naloxone.
Oh, that's Narcan. Yeah, I do have that.
Oh, just in case. Okay.
Just in case you have a problem. Yes.
Okay, great. And Meyer Home Glen. Okay, great. Always double checking. All right.
So the one thing is if you have CRPS and you take opioids, you're going to carry Narcan with you everywhere you go. So if you get pulled over by a policeman, make sure you explain why you're carrying Narcan so they don't think you're a drug addict.
Any changes to history, new diagnosis, new surgeries, emergency room visits, anything outside of Northwestern medicine system?
Yes, actually, I fell down a flight of stairs 6.5 feet in December that went to Bolingbrook Hospital. And then I fell again in February in the kitchen and banged the back of my head off of the doorknob, then the kitchen counter, then the counter knobs, and then the floor. That one I had a concussion and a brain contusion from, and I hyperextended my thumb backwards, which is still kind of bugging me, but,
Wow.
and I don't think those 2 falls would be in, I don't know if Bolingbrook shares through the Everywhere app.
Care Everywhere?
Yeah, Care Everywhere. So those are the 2 falls that I had that I went to the hospital for. I had 2 other falls that I didn't go to the hospital for that I fell up the stairs. I basically fell December, January, February, March, once every month. Oh, I didn't hit the button far enough. Oh well. I'm new to this.
History and all that.
I know, I'm
good.
so new to the YouTube
So we went through your
thing.
history, we went through your meds,
Any recent falls,
Yes.
And then
no
blood
COVID
work
symptoms.
and no COVID symptoms,
Yep.
correct.
And you are fasting starting this afternoon, so.
That's so funny. I'm so new to this because my husband's like, we're on our 3rd case for disability. So my husband's like, you know what, if you want to do YouTube and try to help other people that maybe just got this disease or whatever, go ahead. He's like, I don't think you'll get paid through YouTube, but give it a shot because you're not going to get paid through Social Security. So you might as well just do something fun.
Well, it's a good experience.
Yeah, so we'll give it a shot. And then I'm learning how to splice video and put them all together and
Cool.
yeah, it's kind of fun.
That's a cool thing.
So-
Always good to learn something new. All right, Doctor will be with you shortly.
Perfect.
All
Thank
right.
you.
Great to meet you.
You too.
And I hope your surgery, I'm sure your surgery is going to go just fine.
Thank you. So apparently I'm so new to YouTube, I didn't hold the button down for the entire thing. But what you missed was we checked all of my medications. We went over any recent falls, whether or not I smoked or not, whether or not I had eaten because I'm having blood work done today, and all of the drugs and vitamins that I take. She then did the blood pressure, which you saw on the arm, and took my temperature. And now we wait for the doctor. So far, easy peasy. And here's the thing. Right now, I'm in a lot of pain. But these people don't need to know that. They don't care. I mean, they care for the sake of empathy, but they don't care if you're walking slowly or if you're all down in the dumps and sad. They care about taking care of your health for your surgery. So why be blue and grumpy to somebody that's just doing their job when you can put on a happy face and smile? You can be grumpy in the car, you can be tired in the car, but maybe you'll meet someone who is engaging and makes you feel better just because you put a smile on your face too. I know sometimes it's hard, but it really is a lot of our attitudes on how we deal with this disease. The pain's gonna be there either way. So try to put a smile on your face, try to perk up a little bit, and watch how people open up to you. This disease makes people standoffish and scared. But if we're welcoming, then more people will continue to be welcoming with us. And now we wait. We wait our turn. Basic room here in the United States. Nothing too fancy, but there is a warning that says to protect the privacy of all of our patients and visitors and staff, photography, videos, and FaceTime, Skype conferencing are not allowed in the clinical area, waiting area, bays, or exam rooms or hallways. Thank you. So, yes, we won't be videoing the whole visit. So we're back in the car and we're taking a moment to breathe because during the EKG, when they were taking it off, the woman dropped the cord on my foot. And I typically protect my foot, probably like we all do if you have it in your feet. But because of the EKG, they had to both be perfectly straight. So when that happens, just remember, take a breath. It will come back down. At least in my instance, it does. I get a major flare that typically sends me into breathing like I'm having a baby. And then it reduces back down to my normal pain level. So hopefully that's how it goes for you as well. I do know everyone's body is different, but don't blame the person who has dropped something or stepped on you. They don't know what you're going through, and they certainly wouldn't do it on purpose. So just take a deep breath. CRPS won't kill me, and it won't kill you.